Assalamu alaikum. My name is Ghayat Hussain. I'm an assistant professor at the Faculty of Medicine in King Fahd Medical City. And basically, I'm a physician and I'm a holder of Masters of Bioethics from the University of Toronto, Canada. We are going to talk today about a very important topic about medical ethics, which I believe to be a very important topic that all clinicians, all physicians should be aware of, because it's very basic and it's very crucial actually that we should all know about. This is our outline for today. We're going to talk about the basic definitions of what do we mean by ethics, what do we mean by bioethics and medical ethics, in addition to many other terminology that we use, and how to define an ethical issue. If I have an ethical problem, I have this ethical dilemma, sometimes we say, how to define it. And then we're going to see how we're going to approach these issues in clinical practice from both a Western or, let's say, international approach as well as an Islamic approach. So I would start with asking you a question which seems a little bit embarrassing actually. If you have, these choices, which one would you drink? The milk, this soft drink, or this red wine? Well, most probably we may drink the milk, we may drink the soft drink, but most probably we're not going to drink the red wine. But the question is, will you still have the same choice about not drink alcohol, even if you change the place? Okay, it's here in Saudi Arabia, it's prohibited. If you go abroad, would you change your mind? Okay, most probably not. But why? This is the question. Why? Because most probably would you say, okay, haram, indeed. So basically you have some reference. To which you refer when you take a certain decision this is in our life. Let's go for further examples, which I hope will be less embarrassing. You as a resident or even as a student, I need to pass the exam. Can I cheat? Why not? If you are treating a patient and he is almost dying or he has incurable disease, would you just hasten his death to make use of the organs? You need some money from a pharma company that you are doing a study for. Would you take the money in case they ask you to make some modifications on the results of your research on their drug? Would you do that? You need to be trained. You need to see patients. Would you go, instead, you're a resident, would you introduce yourself to your patient and say that I'm a specialist or I'm a consultant, and so that you can examine the patients? So basically, when we're talking about ethics, we're talking about making choices in our life as well as making choices in our practice. Unfortunately, most of the time, the choices are not black or white. They are not so much clear. So that's why we need medical ethics to help us to go through these choices. I ask you just another question. If I told you that he killed her, what would be your impression, or what would you think? What would you say? Okay, most probably, okay, he's a killer, he's a murderer, he's a criminal, how dare he? Why would he do something like that? But this is our first impressions. Okay, let's see what really happened. It was me, and it was a mosquito that I killed. So basically, when we hear things, when we go through a situation, it's very important actually to know that we should not judge just because we heard something. We have to distinguish our levels of moral response. That is to say, when we take action against something as positively or negatively, we should know very well that there are like 3 levels of moral response. The first is the expressive level. That is to say is It's just this feeling that you have. You have no justification for it. You feel he's a murderer, he's bad. But you need a further level, which is the pre-reflective level, so that here we come to somehow justification, because murdering is wrong, because you talk from a religious background or a legal background. But if I start to discuss with you, then at this point of time, you need to defend your decision, or you defend your judgment about something or someone. At this point of level, this is what we call the reflective level. Medical ethics or bioethics in general is about this kind of reflective level. That is to say that we make an argument towards something or against it, and that's how we defend it, or to tell that this thing is right or wrong. So when we're talking about this exercise of reaching a judgment about an ethical issue, that's what we call the ethical reasoning or the moral reasoning. Basically, as was just mentioned, we have to distinguish between facts and values. Facts are facts. For instance, this patient had this diagnosis, he had that prognosis, but values, including the value of life, what does this illness means to him, his approaching death, what are his fears or her concerns, etc. So basically, we need to distinguish between facts and values. When we need to make a reasonable, an ethical decision, basically, we have to include or differentiate between the facts that we have, the values that we include, and again, the ethical principles, as we will see in a minute. So we'll start more towards more clarification after this introduction. If we ask about ourselves, what is ethics? Let me ask you, what's ethics? If I ask you, what's ethics? Okay, yes. It is a system of moral principles or standards governing conduct. It's about, shall I do this or not to do it? Is it the right thing to do or not the right thing to do? It's a system of principles by which human actions and proposals may be judged good or bad, right or wrong. So basically, it's to help us to know whether it's right, wrong, or good or bad. It's again a set of standards governing the conduct of a particular class of human action or profession. For instance, here, ethics. This is in general. It's about right and wrong. But when we're talking about, as we'll see in a second, when we talk about the medical ethics, so basically we're talking about our profession as physicians or as doctors. Any set of moral principles or values recognized by a particular religion, belief, or philosophy, and indeed the principles of right conducted of an individual or a profession. They are all definitions of ethics. So if we narrow it down to what is bioethics, as the name indicates, bio stands for living or life, and ethicus means moral. So it's basically the science or art that aims at identification, analysis, and resolution of ethical issues in almost any field that is related to human life and health. This is very important, actually, that there are keywords. The first keyword is identification. First of all, we cannot just go, if you have a problem, like you have a dying patient, you are not sure if she's in a vegetative state, shall I pull the plug or stop the resuscitative measurements? Shall I resuscitate this patient or not? Shall I do this abortion or not? Whatever the decision, whatever the dilemma that you're facing, whatever the ethical issue you're facing in your practice, basically, you need, first of all, to identify the problem, then to analyze it, and then we come to the third level, which is the resolution of the problem. So, what are the questions that bioethics help us to answer? Basically, there are three questions that the field of medical ethics help us to resolve, or to answer, actually. First of all, what we should do. Most of the time, we're not sure exactly whether we should do this or not. So what we should do? Shall we, for instance, do the abortion or not? Do the section or not? Go for the operation or not? Treat this patient or not? This is the decision that we need to take. But again, we cannot take any decision and that's it. No, we have to justify. So basically, we're talking about the why question, why we should do it. And then, which is very important actually, is how we should do it. So basically, it's not about you take the decision, you just do it. No, you should learn or know very well how to do the decision that you are taking. So, if we're talking about ethics, just to put it in a diagram, just to make it easier to imagine, ethics, it had bioethics, environmental ethics, social ethics, business ethics, information technology ethics, quite a long list. Bioethics itself, as we mentioned, it's anything related to the field of health. So basically, we're talking about clinical ethics or medical ethics. We're talking about research ethics. We're talking about public health ethics. Again, many fields, almost any field of practice that is related to the health or to humans, more or less has its own branch of ethics. So, but what we're going to talk today, at least in this session, is about the medical ethics or the clinical ethics. So basically, it's a branch of ethics that is related, to, again, to the identification, analysis, and resolution of the ethical or the moral problems that arise in healthcare of individual patients. Again, this is just to compare it for instance, to public health ethics, when we face public issues related to the practice and research in public health, which is related to more towards the population in general. But here we're talking about the individual patient. You are the treating doctor, you as a team, and the relation to your patients. First of all, we need to be clear. When we're talking about the ethical issue or a moral problem, what do we mean exactly? We face issues or ethical issues when we encounter conflicting values, for instance, or beliefs or goals or responsibilities. I'll give you an example. If you are in an ICU, you have only one bed. Then in a car accident, there are two patients. One patient, he is 20-something years old. He has a major trauma, major injury that needs to be immediately resuscitated, while you have another, the older guy, he is like 70 or 80 years old, and he needs he needs to be admitted to the ICU, but with less effort, and the prognosis, or let's say the outcome of resuscitation would be higher. Whom of those two would you admit to this only one bed that you have in the ICU? And again and again and again, many examples are related to different responsibilities. You, the doctor, is responsible to keep this person alive, but you have two persons. At the same time, you have responsibility to keep this person alive, or try to keep him alive. At the same time, you have to make sure that you are not abusing the resources that you have in the hospital. This is one thing. When we are concerned that persons or the rights are not being respected, as we will talk later about the patient rights, we need to know our patient's rights. Many times we feel quite uncomfortable. For instance, if one of your colleagues is talking about a patient, he's telling identifiable information, he's talking openly about this patient or that patient, you feel uncomfortable. You feel like there's an ethical issue here. I don't feel comfortable. It's wrong. But again, we need to know why it's wrong, because one of the patient's rights is not being respected. If concerned about fairness and justice, sometimes, or actually, unfortunately, most of the time, the research done on the poor people, on the vulnerable populations, and we will know later by whom do we mean vulnerable. But when it comes to the production of the drug, unfortunately, those who were researched are not the ones who get the drug by the end of the day, because most of the time the pharma companies want to make big amount of money, and basically they try to sell it to those who have the money. And unfortunately, those who were on whom the research was conducted are not rich enough to buy it. And the bottom line is, an ethical issue is whenever we as practitioners were not sure what to do, or shall we do this or not, and why we should do it or not. So basically, it's more or less, it's boiled down to a very basic question. Shall I do this or not? Okay, if I tell you do it or don't do it, what is my reference? And why do we have different opinions about things if it's a matter of just do it or don't do it? In the coming few slides, we're going to talk quite briefly about the main philosophical or the school of thoughts. I know we as doctors, at least in our part of the world, don't like philosophy a lot. So I'm not going to talk about much details about it, but I think it's quite important to know about the schools of thought or the philosophies that to which people refer when they say that, okay, this is right or this is wrong. If we want to divide the ethics or bioethics or ethics in general, actually, we talk about the main Western philosophies, or what we could say the non-religious or philosophies. We're talking about utilitarianism, we're talking about the ontology, feminist ethics, casuistry, virtue ethics, principalism, and we'll talk about this very, very briefly. There are many other philosophies related to the region, like there are African ethics, Asian ethics, etc. There are the human rights. Some people, including the UNESCO, actually is working on binding human rights to ethics. There are religious ethics. If we're talking about the Abrahamic philosophies like Islam, Jewish, or the Judaism, and the Christian ethics is, again, it's further divided into Catholic, Protestant, Jehovah's Witnesses, and many others. There are the Oriental philosophies like those in China and Japan. We're not going to talk much details about them, but we're going to just to point out the main philosophies. The question is that one of you might think or ask, there are Western philosophies. Why should I know about them? Why should I know about this school, that philosophy? I'm not a Western doctor. I'm not working in a Western country. But again, I believe that we should know about it. First of all, you as a doctor should be able to be practicing in almost everywhere. Everywhere means everywhere. You can be practicing in the United States, in Canada, in Europe, wherever. So basically, you should know about others. The second thing is to bridge the knowledge and culture gaps between us and in our part of the world as predominantly Arab Muslim doctors and other people who are not Arabs or who are not Muslims. The Western literature on bioethics, I mean the recent literature or the contemporary literature, most of it is produced in Western Europe and North America, and we need to know about that. The ethical concepts are quite universal. That is to say, we can make use of, as we will see in a second, that there are many things are in common actually between us talking about our Islamic ethics and the Western ethics. No self-development without knowing others. No way you as a doctor, as a physician, claim that you are developing yourself without knowing the others. And we're talking about knowing the others. We're not talking about just the clinical knowledge or the medical knowledge. It's also important to know more about ethics, to reflect Islamic concept to non-Muslims in an appropriate manner. Because when we, for instance, if you are if you want to continue your postgraduate or your fellowship in the United States or in Canada or in somewhere in Europe or even Australia, so basically when you know what is their background, how do they ethically justify things or make their own moral reasoning, so basically you will be able to talk to them and to reflect your beliefs as a Muslim to them in a proper way. So we're going briefly through the main schools of thought or philosophies, if you like. The first is called the Utilitarianism. Don't worry, it's hard to pronounce. It took me like 2-3 months actually to pronounce it correctly. But it's, again, easier than the second name, which is the consequentialism. So basically, let's keep it Utilitarianism. The Utilitarianism, it says that for an action to be right or wrong, it's based on what are the consequences? What are the consequences of this act? They believe that any act should aim at achieving the happiness to most number of people, the greatest happiness to the greatest number of people. The second school is the ontology, or what they call the duty-based. This is the godfather of the ontology. He is the German philosopher Immanuel Kant. They believe that actions are judged by themselves. They should be attached to principles. It's not about consequences. It's about the act itself. For instance, if it's wrong to lie, then under no circumstances you should be lying. no exceptions for that. If it's wrong to kill, it's always wrong to kill. No way you can have any exception for that. So basically, they are talking about, it's not about the consequences, it's about the act itself. It's about the action itself. It's either right or wrong. There are also the ethics of care, what they call the feminist ethics, which took place actually mainly with the feminist movement in the second half of the last century. It's more about the commitment to correcting male biases. Basically, the feminist ethics is about there is some sort of dominance. They claim that there is some sort of dominance or masculine dominance on the field of ethics by men, and it's quite fair, because if I tell you, give me a name of a female philosopher, you would think like twice before coming up with any name. I can't come with one myself. Another school is called the casuistry. Casuistry is I won't say it's a philosophy, but it says that it's if you want to resolve an ethical issue, just discuss the issue itself. You don't have to attach it to anything. And we have to go through ethics case by case, so that it's more or less like the fatwa kind of thing here in Islam. We go about things case by case. However, in Islam also we attach things to our principles of our religion. The virtue ethics, it's attaching the deed to the doer. That is to say, if you want to you have to be a virtuous person yourself. You have to have virtues in yourself so that your acts come correctly. And they, for instance, if we're talking about who do you have in mind as a virtuous person, perhaps, most probably we're talking, are you familiar with these guys? Gandhi, Oprah indeed, and Mother Teresa, as just models of virtue